Everyone's talking about bone broth as the magic bullet for muscles and joints. But what if I told you science says otherwise? According to a 2023 study published in the American Journal of Clinical Nutrition, adults over 40 who simply added 2 eggs per day to their breakfast had a 12% slower rate of muscle loss, far outpacing any benefit from bone broth. If you've been counting on trendy broths to keep you strong, stick around. Most are missing a critical ingredient for real muscle growth and independence. In the next few minutes, I'll show you exactly why eggs beat bone broth, how the right habits can reverse muscle loss, and the daily steps to stay powerful as you age, backed by hard data and real-life transformations. Let's get started, because muscle isn't a vanity metric. It's your ticket to lifelong energy, balance, and freedom. Before we dive in, quick disclaimer. This video is for educational purposes only. I'm Dr. Hiroshi Tanaka, not your personal doctor. Always consult your healthcare provider before making changes, especially if you have high cholesterol, kidney issues, or special dietary needs. Now let's get you the facts. Welcome to Senior Vitality, and today I'm breaking down 5 daily habits grounded in science that fight muscle loss better than any expensive health fad. I'll explain why eggs matter, why bone broth isn't enough, how hydration, inflammation, and overlooked micronutrients fit in, and more. Plus, I'll share real transformations and a free downloadable checklist at the end. So stay tuned. Habit 1 of 5. Rethink collagen. Bone broth versus the real muscle food. Let's bust the first and biggest myth. Bone broth is not the ultimate muscle builder. The craze is everywhere. But when you dig into research, collagen, the main protein in bone broth, is great for skin and joints, but falls short for building muscle tissue. Why? Collagen lacks one essential thing: the full spectrum of amino acids your muscles use to repair and grow. This isn't just my opinion. A meta-analysis in the Journal of Nutrition 2021 compared different dietary proteins and found collagen lagged behind foods like eggs, dairy, and lean meats in supporting muscle protein synthesis. In simple terms, your body cannot build robust muscle if you're missing key building blocks. Bone broth might feel comforting, but when it comes to laying down new muscle, it barely moves the needle. Now, here's a quick check-in. If you're concerned about muscle loss or want a step-by-step checklist to follow, write "Stronger for Life" in the comments right now. I'll personally reply with extra tips suited to your journey. Habit 2 of 5. The egg protocol. Nature's muscle multivitamin. Let's step into what does work. Eggs. If you're skeptical, you're not alone. For decades, eggs got a bad rap for cholesterol, leading people, maybe even you, to skip the yolks and pile up on bone broth instead. But science is rewriting the story. According to the 2023 American Journal of Clinical Nutrition study I mentioned earlier, adults eating just 2 eggs daily retained significantly more muscle than those who relied on collagen or avoided eggs. Here's why. Eggs are the gold standard for protein quality. They deliver all 9 essential amino acids in the proportions your body needs, especially leucine, a trigger amino acid that flips muscle-building switches in your cells. In fact, scientists use eggs as the yardstick to judge other proteins. The protein in eggs is nearly 100% bioavailable. Your body soaks it up faster and uses it more efficiently than almost any other food. Let's put that into perspective. Imagine 2 people in their 60s. Linda swears by daily eggs, while Tom sticks with bone broth and mostly cardio exercise. 10 years later, Linda is still hiking, carrying groceries, and playing with grandkids. Tom is battling weakness and struggling with stairs. Linda's story is typical, not an exception. And a 2022 meta-analysis in Nutrients confirms this. Older adults upping high-quality protein intake maintain strength, balance, and independence far better than those who don't. But the benefits don't stop at protein. The egg yolk is loaded with vitamin D, choline, omega-3, and antioxidants like lutein and zeaxanthin. All support not just muscle, but also brain, eye, and heart health. For decades, the myth was that whole eggs raise cholesterol dangerously. Modern studies, like a 2022 review in Circulation, found that moderate egg intake, 2 to 3 per day for most people, does not increase cardiovascular risk in healthy adults. However, if you have familial hypercholesterolemia or a history of heart disease, check with your doctor and do not exceed your personal recommendations. When you're over 40, your muscles actually respond less to the same amount of protein as in your youth, a phenomenon called anabolic resistance. That makes it even more important to choose proteins rich in leucine, like eggs, to flip your muscle-building pathways back on. According to a 2021 study in the Journal of Cachexia, Sarcopenia, and Muscle, leucine-rich meals paired with resistance exercise generated up to a 25% greater increase in muscle mass compared to standard protein. So here's your practical protocol. Start your day with 2 whole eggs, boiled, scrambled with veggies, or in an omelet. Pair with spinach and tomatoes for even more benefits. If you have a plant-based diet, don't worry. Right after this, I'll share alternatives that deliver similar results. Quick safety tip. If you have high cholesterol, kidney disease, or diabetes, monitor blood work and check with your healthcare provider before increasing dietary protein or egg intake. Listen to your body. If you experience any adverse reactions, such as digestive issues, scale back and consult a professional. Before we move on, have you felt muscle loss or weakness as you've aged? Or do you want to stay active after 40? Share your thoughts below. Helpful. You might inspire someone else in our senior vitality community. Here's where most programs fail. You can eat the perfect diet and do all the right exercises, but if you're even a little dehydrated, muscle growth and recovery tank. Hydration isn't just about avoiding thirst. Muscle tissue is 75% water. Every move you make, a squat, a stair climb, even standing from a chair, demands water inside the fibers for contraction and repair. Studies in the Journal of Applied Physiology, 2022, show that even 1 to 2% dehydration causes measurable losses in strength, coordination, and recovery. Chronically low hydration over months or years directly increases risk for sarcopenia. But there's more. Water by itself isn't enough. Your body runs on electrolytes: sodium, potassium, magnesium, calcium, chloride. They're the electrical charges that power every muscle contraction. Picture a simple animation. Every time you flex a muscle, sodium and potassium move through cell walls. Calcium triggers contraction. Magnesium enables relaxation. When these are depleted, you get cramps, fatigue, and weaker performance, even if you're eating well. Let's talk electrolytes. As we age, the sense of thirst drops, so many people are dehydrated without realizing. Some medications for blood pressure or diabetes can deplete potassium or magnesium, accelerating muscle loss. Here's your checklist. First, drink small amounts of water steadily throughout the day. Use a reusable bottle if that helps you stay consistent. Second, color check. Your urine should be pale yellow, not dark or clear. Third, where to get electrolytes. Eat potassium-rich foods: bananas, avocados, sweet potatoes. For magnesium, focus on leafy greens and nuts. For calcium, don't skip dairy or fortified plant milks. If you exercise hard, sweat heavily, or live in a hot climate, you might benefit from an electrolyte beverage without added sugars. But avoid extremes. Overhydration, excess water without sodium, can be dangerous. The key is balance. And as always, if you experience dizziness, cramps, or weakness during activity, take a break, hydrate, and consult a doctor if symptoms persist. Real story. John, age 58, was frustrated by recurring muscle cramps despite exercising and eating well. When he focused on magnesium and potassium, added spinach, almonds, and a little more hydration, he noticed fewer cramps and smoother post-workout recovery within weeks. It's subtle, but over months, it's a game changer. Plant-based tip. If you're vegan, many plant foods are loaded with potassium and magnesium. Try a smoothie with spinach, banana, chia seeds, and fortified milk as a breakfast muscle boost. Ready for the next tip? After electrolytes, I'll reveal the anti-inflammatory foods that help your muscles repair and keep you moving into your 70s and beyond. Don't miss it. Habit 4 of 5. Plug into anti-inflammatory power foods. Muscles rebuild after every workout, but only if your body isn't busy putting out fires. Chronic, low-grade inflammation is a hidden saboteur of strength. Acute, short-lived inflammation, like soreness after activity, is normal. But when it lingers, it breaks down muscle tissue and sabotages your progress. So, which foods put out the fire? Let's break them down. First, fatty fish like salmon, mackerel, sardines, and trout, rich in omega-3 that reduce inflammatory molecules. A 2022 study in clinical nutrition found that older adults supplementing with omega-3 increased strength and improved muscle response to resistance exercises by over 10%. Second, berries like blueberries, strawberries, and raspberries, high in anthocyanins and vitamin C, antioxidants that fight damage from exercise and daily wear, helping recovery. Third, leafy greens, such as spinach, kale, and Swiss chard, pack magnesium, vitamin K, and phytonutrients that lower inflammation and support contractions. Fourth, turmeric with black pepper. Curcumin in turmeric blocks inflammatory pathways but is much more potent with pepper for absorption. Studies continue to show reduced muscle soreness and improved performance when both are combined in meals. Fifth, nuts and seeds. Almonds, walnuts, chia, flax provide healthy fats, magnesium, and antioxidants. Walnuts in particular feature plant-based omega-3, important for vegan viewers. Sixth, olive oil, extra virgin, contains oleocanthal, which works much like ibuprofen, lowering inflammation but without medication side effects. The Mediterranean diet's health track record is in part due to this powerhouse oil. Let's not forget legumes, beans, lentils, chickpeas. These offer protein, fiber, and short-chain fatty acids that support gut health, critical for keeping body-wide inflammation low. Now, here's a story. Sylvia, age 67, struggled with persistent joint and muscle soreness after taking up beginner strength training. She started adding a daily bowl of berries, a handful of walnuts, and swapped seed oils for extra virgin olive oil. Within a month, not only did soreness ease, but her motivation came roaring back. Turns out, science backs her up. A 2023 BMC geriatric study found that older adults eating an anti-inflammatory diet reported both less pain and greater gains from exercise. Bonus tip: are you plant-based? Drop a plant power in the chat. I'll cover more plant alternatives, including specific beans and seeds, next episode. Don't miss your inclusive guide next week on senior vitality. Haven't subscribed? Now's your chance. Subscribe for weekly evidence-based nutrition and longevity tips. The next video is your plant power roadmap, so hit that bell so you don't miss it. Before we move to the last habit, want to track your personal progress? Download my free weekly muscle strength and hydration tracker. Link is below. Record your checks and see real improvement over time. Habit 5 of 5. Build a balanced plate and routine. Ultimately, there's no silver bullet. It's the combination of these daily habits that reprogram how you age. Here's your formula. First, start each meal with a high-quality protein. Eggs, or for plant-based, lentils, tofu, or tempeh. Backed by a 2022 Frontiers in Nutrition review that showed similar muscle response when total protein content is matched. Second, add fiber-rich veggies and antioxidant-packed fruits, berries, spinach, tomatoes, peppers, greens. Third, splash in healthy fats, olive oil, avocado, nuts, seeds. Fourth, drink water regularly, accounting for electrolytes from whole foods. Fifth, after workouts, make time for protein within an hour. It's your optimal window for muscle rebuilding. If you're new to exercise, even simple routines work. Try body weight moves, squats, modified push-ups, resistance bands, 2 to 3 times per week. Progress from supported chair squats to full squats, or from wall push-ups to countertop and then knee push-ups. Safety always comes first. Pain is a warning. Sharp stabbing or persistent pain, especially in the chest, joints, or back, means stop and check with your healthcare provider. Never push through injuries. Adjust intensity to your fitness level and seek guidance from a physical therapist if you're unsure. If you're following plant-based nutrition, aim to pair grains and legumes, brown rice with beans, peanut butter on whole grain toast, to ensure you get all essential amino acids. And always discuss new dietary changes with a registered dietitian if you have kidney, metabolic, or medical concerns. Wrap up and transformation proof. Let's circle back. Strong, healthy muscles are not a gift. They're a daily choice. Remember Linda, who made breakfast eggs a habit? Or John, who fixed cramps by eating more greens and nuts? You can experience similar wins by starting with these 5 steps. Here's your recap checklist. First, rethink collagen. Choose proven protein over hype. Second, prioritize eggs or plant-based alternatives for complete muscle fuel. Third, master hydration and balance those electrolytes. Fourth, harness anti-inflammatory foods for daily repair. Fifth, build a balanced, colorful plate and routine tailored to your needs. Download your free 5 daily habits checklist and muscle tracker via the link below. Stick it on your fridge. Check your progress weekly. And remember, losing muscle isn't a punishment of aging, it's a choice. Choose differently, and your future self will thank you. Last note. This was packed with science, but always remember, this isn't medical advice. Individual needs vary. If you have health conditions or are on special diets, review changes with your doctor. If you experience severe muscle pain, weakness, or sudden changes, seek medical help right away. Aging does not have to mean decline. With these daily habits, you can stay powerful, independent, and vital at any age. Let's quickly recap what you've learned today. The 5 daily habits to fight muscle loss are: choose proven protein, skip the bone broth hype, make eggs or plant-based protein a staple, stay hydrated with the right electrolytes, use anti-inflammatory foods for faster recovery, and build a balanced, colorful plate with each meal. Start with what you can today. Add eggs or a high-leucine plant protein to your breakfast. Build up your hydration and include potassium and magnesium-rich foods. Gradually incorporate resistance training. Try chair squats or wall push-ups if you're a beginner. Over weeks, progress to more challenging exercises and more diversity in your meals. Month 2, assess your tracker and tweak as needed for continued gains. Listen to your body. Any sharp joint pain, chest discomfort, or persistent weakness is your cue to stop and check with a health professional. Always consult your doctor if you have cardiovascular, kidney, or metabolic disease before making these changes. If anything feels off, play it safe. Most people notice more energy and subtle improvements within 2 to 4 weeks. Visible increases in muscle strength, stamina, or balance are often noticeable by 8 to 12 weeks, especially if you're consistent. Download your free checklist and muscle tracker below, your structured roadmap for lasting progress. And if you're plant-based or have dietary restrictions, you're included. Subscribe now for my next video covering all plant-powered options for strength at every age. If you found this valuable, comment your age and your top muscle goal for the year. Engage with your fellow senior vitality community. It helps you stay accountable and inspires others. Remember, this video is for educational purposes only and not a substitute for personal medical advice. Always talk to your healthcare provider before making major diet or exercise changes, especially if you have health conditions.